The treatment of severe and complicated falciparum malaria. These are also prophylaxis or dosage forms for severe and complicated falciparum malaria. Artesunate 2.4 mg per kg intravascularly or intermuscularly. Intravenously or intermuscularly twice a day. The day one at day one, then 2.4 mg per kg daily for 7 days, or artemether to 3.2 mg per kg intermuscularly on day one, then 1.6 mg per kg daily for 7 days, or RT-ether 3.2 mg per kg intermuscularly on day 1 followed by 1.6 mg per kg daily for next 4 days. Switch over to 3-day oral artemisinin combined therapy in between whenever patient can take oral medication. Or quinine 20 mg quinine salt per kg on admission, like intravenous infusion of 5% dextrose per dextrose saline, dextrose or dextrose saline over a period of 4 hours, followed by maintenance dose of 10 mg per kg body weight, 8 hourly. Whenever patient can swallow orally, switch over to oral quinine 10 mg per kg 8 hourly and complete 7 days course. So, in case of children, malaria occur in case of children, then quinine parenteral is high toxicity and orally well tolerated. Primaquine avoided in neonates. Mefloquine not used in children below 15 kg weight, and acute malaria in pregnant women. Chloroquine is usual doses. Mefloquine in first trimester. Primaquine and tetracycline avoided in these cases for pregnant women. Anemia, folic acid, and iron is given. As anemia, folic acid, and iron is given. Like the practice points is most antimalarial are bitter in taste. Give along with milk or fruit juice. If vomiting occurs within hours or of drug, repeat full dose. In case of mefloquine, repeat half dose. If vomiting after 1 hour, no need to repeat. Postural hypotension is occur in case of quinine and chloroquine. Then the drugs which is used in chloroquine resistant malaria, they are mefloquine, quinine, sulfadoxine, trimethamine, artemisinin compounds like uh, artesunate, then artemether, artemether. So just a small revision you can take, because you guys don't need to read all these things. You just have to read that what is malaria, by what is the causative agents or causative parasites by which this malaria can appear, like the plasmodium species. And these are the parasites. The plasmodium species are there. The 4 types of plasmodium species are there. Plasmodium vivax, Plasmodium ovale, Plasmodium falciparum, and Plasmodium malariae. In these 4 species, Plasmodium falciparum is dangerous one. So how does it one person get affected by this Plasmodium vivax? This is attacked by the vector by the bite of mosquitoes. So the Plasmodium, this parasite, first comes to the blood of a mosquito. Then if that affected mosquito bites a human person, human beings, then the parasite comes to the human body. After reaching reaching the liver, it still remain immature, and after reaching the liver it get matured and comes to the human blood. If another mosquito bites the infected human, then the parasite comes to the uh, new mosquito, then it bite another person. That's how the malaria gets entered to one human to another human. These are the symptoms of malaria. You have to read that what are the symptoms, like respiratory, stomach, what is the stomach nausea, vomiting, liver, then back pain, spleen enlargements, and the systemic actions, the symptoms happening here. And we have to just remember one thing, that this malaria can cause to mother can cause for the newborn baby from a mother. These are the species, and you guys just need to read the classifications of malarial drugs. These can be classified into two type based on two types, like by therapeutically or by chemically. Therapeutically, casual prophylaxis, which are here, and suppressive prophylaxis, and this the therapeutic classification, and these are the chemical classification. You guys just remember this classifications only. And one thing here, chloroquine, just read this chloroquine elaborately. After this, nothing, you just read once, but don't memorize it. Memorize just these things, and previously I just told the previous things. Just remember, just memorize that things only. The mechanism of actions you have to read, then pharmacological actions you have to read. This is not too much important. And this one thing that adverse drug reactions. Okay, so thank you.